Cambridge International A2 Level Psychology. Obsessive-compulsive and related disorders.
Obsessive-compulsive and related disorders. Characteristics: obsessions, intrusive, recurrent thoughts and unwanted urges; compulsions, repetitive actions that impair normal functioning. Patients with OCD will often be compelled to suppress obsession to reduce anxiety and gain temporary relief. However, these compulsions are excessive and unrealistic. For example, a person having a fearful obsession of accidentally hitting someone may be compelled to engage in continuous counting. Hoarding, experiencing great difficulty and distress getting rid of possessions, negatively affecting their social life. Your homes may be unsafe due to hygiene or access issues. Body Dysmorphic Disorder (BDD), obsessive thoughts regarding perceived faults in one's physical appearance. 1. These faults are slight or not obvious to others. The obsessions are often focused on imagined flaws or defects on the face. The anxiety caused by obsession leads to compulsive, repetitive behavior, for example, frequent mirror checking, excessive grooming, hair washing, shaving, etc., and comparing oneself to others. Case studies: Charles by Rappaport, 1989. 14-year-old boy with OCD who spent 3 hours showering and 2 hours getting dressed. He had repetitive routines for holding soap in one hand, putting it under water, switching hands, and so on. His mother contacted Rappaport after the child exhibited this behavior for around 2 years. He was utterly obsessed with the thought that he had something sticky on his skin that had to be washed off, causing him to leave school. He had also had trips to the hospital where he received standard treatments of medication, behavioral therapy, and psychotherapy. He was socially isolated as his rituals left him little time outside the house. He underwent a drug trial for clomipramine antidepressant, giving him effective relief of his symptoms. However, he developed tolerance to it and relapsed. Measures: Maudsley Obsessive-Compulsive Inventory (MOCI) and Yale-Brown Obsessive-Compulsive Scale (Y-BOX). MOCI quick assessment tool takes around 5 minutes to complete and is scored between 0 to 30, consists of 30 items that are scored either true or false, which assesses symptoms related to checking, washing, slowness, and doubting. For example, I frequently have to check things. Checking: I am excessively concerned about germs and diseases. Washing: I don't take a long time to dress. Slowness: despite doing something carefully, I often feel it is not quite right. Doubting. Y-Box Goodman et al. 1989 consists of a 30-minute semi-structured interview and a checklist of different obsessions and compulsions. Checklist includes a 10-item severity scale allowing individuals to rate between 0 to 4 time spent on obsessions and compulsions, how hard they resist, and how much distress they cause. Total scores range from 0 to 40, where 16 is the range for over 16 is the range for OCD. Obsessions, aggressive contamination, sexual hoarding, religious symmetry, body focus; other compulsions, cleaning, washing, checking, repeating, counting, ordering, arranging, hoarding, and others. Explanations of OCD: biomedical, genetic, biochemical, neurological. Genetic suggests that patients with OCD inherit specific genes that cause OCD. A large-scale study by Matheson et al. 2015 involving 1,406 people, both with and without OCD, were analyzed. Two genes, PRD and SLITRK3, interact to regulate particular synapses in the brain. The irregularity of these synapses lead to neurological disorders like OCD. DRD4, dopamine receptor D4, is related to uptake of dopamine. Its abnormal levels are implicated in OCD, for example, high levels of dopamine associated with compulsive behavior. SERT onin transporter gene can cause low levels of serotonin, which is associated with OCD and depression. Biochemical oxytocin, or love hormone, is known to enhance stress and attachment but can also increase stress and fear of certain stimuli, especially those that pose a threat to survival. By analyzing cerebrospinal fluid and patient behavior, Leckman et al. 1994 found that oxytocin levels are higher in patients with OCD and found a positive correlation with a higher frequency of repetitive behavior. OCD behaviors could be at the extreme end of the normal range of behaviors moderated by oxytocin. Neurological abnormalities in brain structure and function. The basal ganglia and two associated regions, orbitofrontal cortex and cingulate gyrus, work together to send and check warning messages about threatening stimuli. In brain damaged case study patients, the checking loop doesn't work as it should, so the basal ganglia continues receiving warning messages relating to the obsessive thinking symptom of OCD. Note heightened activity in the orbitofrontal cortex increases conversion of sensory information into thoughts, obsessions, and actions behaviors leading to compulsions. PET scans have found higher activity in the orbitofrontal cortex in patients with OCD. Cognitive and behavioral OCD consists of cognitive obsessions and behavioral compulsions. Obsessive thinking is based on faulty reasoning, for example, belief that hands covered in germs kill. Compulsive behaviors are outcomes of erroneous thinking, attempts to alleviate obsessions, and associated anxiety. Such behaviors are learned can be explained via operant conditioning. 1. Hand washing is the negative reinforcement as it has relieved something unpleasant, obsessive thoughts. 2. It is also a positive reinforcement as a person is rewarded by knowing they have cleaner hands. Psychodynamic. Freud emphasizes the unconscious beliefs and desires to explain OCD and how childhood experiences share personality, shape personality. OCD symptoms result as an internal conflict between the id and the ego. Freud suggests that conflicts arise in the inner stage of psychosexual development. Around this time, most children begin toilet training. There's a tension between parents and children as the parent may want to control when the children def- defecates or urinates against the child's wishes. Child may soil themselves to regain control, upsetting their parents, leading to another expulsive behavior, being messy and careless. Alternatively, they may fear harsh responses from parents and retain feces or urine to regain control. Leads to another retentive behavior, compulsive need for order and tidiness. Another retentive expulsive behaviors can lead to behavioral disturbances as the individual has become fixated in this stage. Fixation when conflict at psychosexual stage remains unresolved and the person is unable to move on to the next stage. Obsessive thoughts coming from it disturb the rational part of self-ego to the extent that it leads to compulsive cleaning and tidying rituals later in life to deal with childhood trauma. Evaluation. Genetic objective and usually controlled under lab conditions, making it highly replicable. One, however, it is not explained why some individuals may carry genes that are implicated in OCD but never develop symptoms. Biochemical oxytocin hypothesis supported by lab-based studies. However, it is difficult to establish a causal relationship between hormone and OCD symptoms. Neurological supported by case studies on brain damaged individuals, but this lacks generalizability to other OCD patients. psychodynamic, not supported by research as you can't mention or control variables involved, so no causal relationship found, for example, between harsh toilet training and later compulsive washing. Issues and debates. Biomedical explanations are potential areas for research into treatment and management of OCD. Individual explanation, biomedical, cognitive, and behavioral explanations focus on the individual, for example, hormonal abnormalities and faulty thought processes, making it reductionist. Situational explanation, psychodynamic explanation emphasizes the effect of early social relationships on an individual's development. Nature biomedical explanation, genes, hormones, brain structure, nurture behavioral, learned behaviors, both nature and nurture psychodynamic natural urges are we are born with versus childhood experiences. Deterministic, no free will to influence genetic makeup or automatic learning process leading to OCD. Treatment and management of OCD. Biomedical SSRIs. SSRI acts on serotonin transporter, increasing its level and acting as a treatment. Sumra et al. 2008 reviewed the results of 17 studies comparing effectiveness of SSRIs with placebo. In all studies totaling 3,097 participants, SSRIs group was more effective at reducing OCD symptoms, show using Vybox shown using Vybox 6 to 13 weeks after treatment. SSRIs reduce severity of OCD as they seem to lessen the anxiety associated with it. Psychological therapies. Cognitive level at al. 2006 and exposure and response prevention Leckman et al. 2008. Cognitive aim to compare effectiveness of CBT delivered by telephone versus same therapy offered face to face. Sampled 72 patients from two different hospitals. Procedure level at al. Used RCT wherein participants underwent 10 weekly sessions of therapy either by telephone or face to face. Changes in well-being were measured via Vybox, BDI, and a client satisfaction questionnaire. Results 6 months after treatment, Vybox scores significantly improved in both groups along with high participant satisfaction, suggesting patients may benefit equally from both forms of CBT. Exposure and response prevention (ERP). Leckville et al. Researched the application of this form of CBT with a 12-year-old boy, Jason, who had OCD, both OCD and autism spectrum disorder (ASD). Jason experienced contamination fear, excessive hand-washing, counting, and checking. He spent several hours daily in compulsive behavior, having anxiety when prevented from his rituals. ERP consists of gathering information about existing symptoms, therapist-initiated ERP, and generalization and relapse training. Procedure Jason attended 10 50-minute CBT sessions over 16 weeks, and ERP techniques were modified to fit Jason's needs. Identification and coping Jason first identified feelings of distress and with the help of the therapist learned coping statements when he felt anxious. Some ERP techniques were modified to fit Jason's needs. He was not asked to do visualization exercises as he will find it impossible to imagine pretend situations. Exposure. He was exposed to stimuli which he felt were contaminated and produced feelings of anxiety or disgust. Door handles, elevator buttons, when he was asked to touch them repeatedly until he became habituated and his anxiety levels dropped. To mid-sessions, he was exposed to specific tasks in his normal environment, handing out papers in classes or using contaminated items at home. Results: Jason's score on Ybox dropped from severely high pre-therapy score of 18 to just 3, normal. At the 3-month follow-up, his score remained low and he showed improvement in both OCD symptoms and participation in social activities. Evaluation. Cognitive therapy level at al. Used independent measures design where participants were randomly allocated to two conditions, removing researcher bias. Face-to-face CBT group acted as control group, so researchers could compare the results and effectiveness of ERP to the control group. When validity and reliability duration of therapy in both groups was the same, and outcomes were measured using the same validated scales. 2. Limited generalizability. Case study was used and participant had ASD2, thus represented unrepresentative of the general OCD population. Ethical issue. Jason was a child with additional needs and issues regarding briefing consent and risk of psychological harm. Qualitative and quantitative. In-depth qualitative data through ERP and interviews along with quantitative data via white-box scores. Issues and debates. Use of children in psychology. One SSRI are generally considered safe but sometimes restricted in case of children with OCD due to risk of harmful side effects. Ethics. Jason's parents will have had to give consent on his behalf. Some procedures of ERP were altered to accommodate his age and ASD needs. Application to everyday life. CBT and SSRIs are frequently used OSD treatments. Individual explanation. SSRIs only treat one aspect, the individual's serotonin uptake, ignoring what may have caused the OCD symptoms to emerge, thus also being a reductionist approach for treatment. Situational explanation. CBT considers the environment in which the compulsive behavior takes place. For example, Jason's therapy addressed triggers in home and school environment in order to help prevent relapse. Don't forget to subscribe and hit the notification bell, new videos every day, and like this video, comment on it, and share this video as well.